Sex therapists of Reddit, what's the most common problems people have? Story 1.
Okay, I am a real sex therapist. All of the people in this thread are making jokes, and also have no understanding of what a sex therapist does. I hope you fulfill your dream of becoming a sex therapist. It's more rewarding than any job I can think of, and you can help many people on a deep level. I'm not going to share any stories with personal clients, out of respect, but I will share a little bit about what it's like. People come in, usually people who were virgins for a long time or have had some abuse in the past, with some fear of sex, and some ideas they have been marinating in for years about why it can't work with them, or why they will fail. I deal mostly with men with performance anxiety. They are the most frequent patients, and they typically believe they have very severe problems. There are also a lot of older men who are fearful that their sex drive is going away, and it causes undue stress. Yes, I can tell that they are genuine. They are not just using me like a prostitute. After a couple sessions, yes, even though they pay me in full, we don't have sex the burst session of talking, basically normal therapy, except explicitly sex-focused. I'll sit on their lap, let them put their hands on me gently, etc. Basically, I'm trying to make sure they stay present, and don't fall into stress or trauma, as may be the case from their past. We only get busy when they are comfortable at their speed. I recommend meditation before and after each session to all my patients, and also to anyone else during their free time. It helps you sit through your trauma and kind of reset yourself, keeping you more open to therapy, new experiences, and changing yourself intuitively. The overall goal is, well, it's whatever they want it to be, as long as it is a healthy goal. That's why being a sex therapist is so great. You make so many people happy on such an intensely deep level. And it's very professional. Protection is always used, and I've never had a patient get weird, stalking, asking me to be his girlfriend, etc. I recommend taking classes and talking to licensed professionals in your area to learn more about the job, classes, and if it's right for you. Good luck. PM me any questions you might have. Edit. I am a sex therapist. I also perform the functions of a surrogate. Many people have replied to my comment antagonistically claiming that I am not a therapist, and I am misrepresenting my profession. I have a master's degree in therapy, and my job is sex therapist. About half of my sessions do not even involve sex, and I sometimes see patients without ever having sex through their entire time with me. I am not covered by health insurers due to the surrogacy involved in my practice, but I am a sex therapist. Straight up. U/Sandalsta is incorrect in saying that I am not a sex therapist.
Story 2.
Clinical psychologist from Germany here. I'll try to give a serious answer. A lot of problems couples have in bed result from unrealistic ideas about how good sex should be. For example, there was this one guy who told me he suffered from premature ejaculation. He was afraid that his girlfriend who he was dating for about 2 months would leave him because of it. He was pretty reluctant about details, so I started questioning him about previous relationships. I was pretty surprised that he never considered his stamina a problem before, so I talked to his girlfriend. As I asked her about how long her boyfriend would last, she told me in an embarrassed and desperate manner, "You know, he always finishes after only 25 minutes or so." So in that case a little sex ed did the trick. Sexual dysfunctions, like premature ejaculation, erectile dysfunction, sexual pain etc., are the most common problems though. The standard treatment for these, if the cause of the problem is not biological, is sort of a reprogramming of the couple's sexuality. It's called sensate focusing by Masters and Johnson. The convenient thing about this method is that you can adjust it to almost any sexual dysfunction and every couple's needs. Depending on the dysfunction, specific exercises can be added, for example the start and stop technique for premature ejaculation, dilators for vaginismus or masturbation training for anorgasmia. One reason why sensate focusing works really well is that in comparison to other psychological treatments it's actually pretty fun. Not every couple has to go through every step. If the dysfunction occurs in a later stage of the sexual response cycle, a few steps can be skipped. The couple can move on to the next step when both partners can enjoy and are relaxed during the current step. Besides, for the whole treatment, except the last few steps, full intercourse is forbidden. In a lot of cases in which the couple has regular sex before the treatment is over, their problems will come back again. Also, the sex interdiction usually takes a lot of pressure off the partner with the dysfunction and builds up a lot of excitement for the couple. Edit 2. Just to be clear, I told my patient's girlfriend that her expectations were way too high. Healthy adult males on average ejaculate after 4 to 8 minutes of plateau phase. Edit 3. As some of you have messaged me regarding problems with your partners, let me say this: I cannot give proper counseling over the internet, only some basics. If you or your partner really suffer from sexual problems, please seek professional help.
Story 3.
My wife is also a teacher and can talk all day about the screwed-up system, but despite plenty of tough spots she's had to be in, she's never had to stubbornly refuse to listen to a student. She's actually super into letting students challenge things, and if they don't line up with her expertise, she invites them to research it on their own and present her with the evidence. Usually they find out she's right, other times they find something that neither they or she knew ahead of time, and very rarely she may be slightly wrong about a detail. But at the end of the day, that student learned the material and they learned how to research, and they learned how to back a claim with evidence. Also, my wife occasionally learns something new and interesting because of a student being inquisitive about something beyond her knowledge. It's such a win-win-win-win. But it requires teachers to not teach as though knowledge is some authoritarian edict where the information is passed from on high and is unquestionable. Knowledge is constantly moving and changing, and nobody, especially teachers, are infallible. You're right that teachers aren't perfect, and that's exactly why this is important. If they make a mistake and get called on it, they should admit it. The bigger flaw would be to insist on the misinformation for the sake of saving face or demonstrating some sort of hierarchical structure, which I ran into plenty in HS, to the point that a principal actually told me that if my teacher said 2 + 2 is equal to 5, that's what I should put on the test. He was ex-military and believed absolutely in hierarchy.
Story 4.
My parents once were giving this advice to my sister, and made her understand by telling her a story. There was a very old couple sitting at a breakfast table. The woman, after 60 years of marriage, finally had a sort of individualistic streak, and decided that instead of giving her husband the soft part of the bread like she always did every breakfast, she would eat that part herself, and give her husband the crust. She hated eating crust, but today it was her husband's turn to eat the crust. She would keep what she thinks was the best part for herself. The husband smiled very happily, a smile she has not seen in a breakfast in many years. Oh dear, thank you for giving me the crust. It is so much better than eating the soft part of the bread. Since it is always you that handle the bread, I always let you eat whatever part you wanted.
Story 5.
So one of the most common problems I see is an unequal sexual urge between partners. I'm sure most people will immediately think the issue is wives and girlfriends who don't want sex as much as their husbands, but the reverse is just as common. It pops up pretty regularly with gay, lesbian couples too. Usually there's a specific reason for it. Weight gain, stress, all kinds of stuff. To give you an interesting example, a while back a couple came to me with a bunch of marital problems. The wife had a lot of complaints about how her husband had changed. He'd become less attentive. He didn't help out as much. After about 10 minutes into the session, it was pretty clear the root of the problem was that she wasn't being satisfied sexually. I asked them how many times they had sex in a week, and it turned out they had sex maybe once or twice a month. I asked the guy how often he masturbated, and he said 5 to 7 times a day. Of course, his wife was shocked. So I asked him, what is it that arouses you in the porn that you don't get from your wife? To which he just kinda looked away embarrassed. His wife looked at him and asked, please, just tell me what I can do. Who do you need from me? He sat there quietly for a second, sighed, and said, I'm gonna need about 350. It was about that time I realized that my client was a 500 feet tall crustacean from the Cretaceous era. Then I said, goddamn it, Loch Ness Monster, I ain't giving you no 350. Needless to say, I counseled them to find a way to amicably separate. The one issue I discovered pretty much precluded any sort of meaningful relationship.
Story 5.
All humans are equally insecure about their genitals. What they look like, what they do, how they smell, everything. A good third of the stuff I did was essentially reassuring people that they weren't abnormal / someone was going to laugh at them when they got naked. Another biggie? The confessions you get of wrongdoing and sheer stupidity when someone is afraid of being pregnant or having an STI is staggering. They're all people who have an awareness of things like contraception, but either don't know all the facts or just plain ignore them. Most of these involve me trying to diplomatically suggest that they use the scare to actually use condoms consistently, and maybe get tested if it sounds like they have due cause. The most common thing though was pretty cliché, and so is the response, "I'm afraid. My SO wants to do this, but I'm not sure / uncomfortable. I hate it when my SO does this, how can I? My SO won't do this, how do I?" Yada yada, you get the point. The solution? Talk. My mind boggles how people are more comfortable at someone manhandling their genitals, regardless of their enjoyment / sense of safety, over talking about them. If you can't talk about what you're doing with a partner honestly without fear of mockery / causing offense, you shouldn't be doing anything with them, if you should be with them at all. If you want more specific things in terms of ailments, sex acts etc., let me know. I've kept it pretty vague. But, from my experience, when sex is a problem it's way more to do with emotional stuff, insecurities, and relationship problems than something like logistics, though that comes up too. Edit. WOAH, that's a lot of replies for a habitual lurker. I'll try and get through them all between work. Also, I apologize for my poor phrasing regarding the rather heavily contested word all, being, equally, healthy and natural, and preferable. Of course there are those who are happy with their genitals. Glad to hear it. My meaning, though I appreciate it was poorly conveyed, is that by everyone, I meant we are all equal regarding things such as age and gender, in our insecurities or lack thereof.
Thank you for watching. Be sure to comment your opinion about these stories, and don't forget to subscribe to the channel so you don't miss new stories.